You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
You're listening to the NASP Podcast. This specialty pharmacy podcast is a collaboration with the National Association of Specialty Pharmacy and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the NASP Podcast, in collaboration with the National Association of Specialty Pharmacy.
Hello, my name is Sheila Arquette, and I'm the President and CEO of the National Association of Specialty Pharmacy. I am delighted to welcome a very special guest, Amy Niles, PAN's Chief Mission Officer, to this episode of the NASP Podcast. Amy Niles is a knowledgeable healthcare executive with a passion for growing sustainable health organizations, advocating for patients, and building strategic partnerships to address public health needs. As PAN's Chief Mission Officer, she leads the organization's educational initiatives, program development, clinical affairs, and advocacy strategy, while overseeing public policy and advocacy initiatives, external relations, and marketing and communications. She developed the framework for PAN's National Advocacy Platform in 2013 and has been leading the initiative ever since. As a result of her leadership and proactive analysis of the legislative and regulatory environment, external stakeholders and policymakers have come to view PAN as a thought leader and go-to resource. She has been quoted in the New York Times, Time, and HuffPost, and she has authored and co-authored numerous opinion pieces and articles about Medicare reforms and affordability. Amy believes that no one with a serious illness should have to worry about how to access and afford treatment. She is motivated every day by the knowledge that she is working to fill gaps in the nation's healthcare system to support vulnerable populations, one person at a time. She has previously helped lead successful startups and growth initiatives, including the Together RX Access Program. She co-founded, developed, and served as president and CEO of the National Women's Health Resource Center, which grew into a national clearinghouse for women's health information under her leadership. Amy has more than 30 years of experience in health nonprofit leadership, including strategy, external relations, and board governance. But her colleagues are most impressed by the way she leads with her heart and her dedication to every person PAN serves. She holds a Master's of Business Administration from Baruch College, City University of New York, and an undergraduate degree in biology from the University of Rochester. Amy also serves on the Specialty Pharmacy Certification Board, an unincorporated division within the National Association of Specialty Pharmacy, and is a member of the Center for Value-Based Insurance Designs Advisory Board. Amy, thanks so much for joining me today.
Thank you, Sheila. It's great to be with you.
So tell me a little bit about your title, because I'm very intrigued by Chief Mission Officer. Can you describe, tell me what that's about?
Sure. And it's funny, you're one of several people who have asked me the same question just over the last month. I love the title of Chief Mission Officer. I think the reality when you're working in a nonprofit organization, really every single person in that organization is working toward the mission, right, of the organization. But as Chief Mission Officer, I sort of have this 30,000-foot view and responsibility for several of the areas that you mentioned in the intro. One is I'm overseeing all of PAN's advocacy and policy work. And I love that work. Sometimes when people ask me, what makes me wake up in the morning and come to work, it's the ability to, through the work that we do in our financial assistance programs, it's, the ability to help a patient one at a time, but through the advocacy and policy, the potential opportunity through legislation to really impact millions. So I oversee all of that work, all of our new programs and education, and thinking about the new assistance programs that are needed by patients. All of that work kind of falls to me, supported by a great team of people at the PAN Foundation.
Sure. I mean, that's incredible when you think about the number of patients that you can impact, but also kind of daunting, right? I mean, a lot of it's resting on your shoulders.
Well, we do a lot of certainly policy work on our own, but so many of the issues that, and I know we're going to talk about a few of them today, but so many of the issues that we advocate for are also important to many other patient groups and provider organizations like NASP. And so there's often an opportunity to work side by side with those organizations, because I think for many of these issues, if we work collectively, we're much stronger and have a better chance, perhaps, of getting legislation passed, which can be really difficult, as we know.
Absolutely. So this year marks the PAN Foundation's 20th anniversary. Congratulations.
Thank you.
And I understand you have all recently expanded your mission. Can you speak to who the PAN Foundation is today and what impact you all have on people nationwide?
Absolutely. We are celebrating our 20th anniversary this year. We were founded in 2004. And I think, so many people likely listening to this podcast know PAN as a charitable foundation, providing financial assistance to people who are underinsured. And that financial assistance is helping people, start and adhere to treatment. That work is critically important. It remains critically important, and we will continue to do that important work. In fact, today we have about 80 different programs through which we can provide financial assistance to people who are underinsured. We're humbled to do this work. I always say, gosh, I wish our healthcare system was such that we actually didn't have to do this work. But over the 2 decades that we've been in existence, we have helped more than 1.2 million people. And we provided about $4.5 billion in financial assistance, which is a crazy number. And I know there's so much more work to be done. But we are proud to have recently expanded our mission because we have recognized the importance of advocacy and education on improving health outcomes and enhancing access to care. So our new mission is to accelerate access to affordable and equitable healthcare through financial assistance, advocacy, and education. And we call financial assistance, advocacy, and education the new PAN pillars.
Wow, that's interesting. That's really interesting. And so one of the words that you said kind of jumped out at me, because I think the first time I began to appreciate it is when I was working with you, or I had the opportunity to hear you speak, and that's underinsured. So we're not just talking about people that don't have health insurance or prescription drug coverage at all. We're talking about people, that may have a large out-of-pocket, or cost share deductible, something like that. Is that what we mean by underinsured?
Yeah, the people who have insurance, they may have Medicare, they may have commercial insurance, but yet they find themselves spending, maybe 10% or more of their household income on treatment costs. So, what we have seen at PAN is, and we're particularly focused on prescription medications, the people we are helping are those who are living every single day with one or more chronic conditions. And they are often prescribed specialty medications. They come with, high cost. And so what we have seen over the 2 decades, it's not uncommon for someone to, unfortunately, have to spend thousands and thousands of dollars out of pocket to afford their prescription medications. Most of the people we are helping at PAN are people on Medicare. They, as you may know, people with federal insurance cannot get direct support from specific pharmaceutical manufacturers. So foundations like PAN really become perhaps the only place they can turn to get financial assistance. And, for that person on Medicare, it's really important because imagine being an 85-year-old, having a fixed income of $30,000, you're diagnosed with a serious illness, and you're told that you have to spend $5,000 for your medication. Now, a lot of that is changing, and we're going to talk about that today, but it becomes unaffordable for many, many people. And so that's why the safety net that we and other foundations provide is so important.
Oh, 100%, right? You hear all the time about people having to make choices, right, between their prescription drugs and food or utilities or, some other, and not even like a want, right? Some other need that they have. And that shouldn't be a choice anybody has to make.
We hear it every single day from people that they're making those choices. They're walking away from the pharmacy counter. We know statistics tell us that 1 out of 3 adults walk away from the pharmacy counter because those out-of-pocket costs are just not affordable. So it's not what we strive for. People should not be forced to make these decisions. We have what we call our Patient and Family Advisory Council. And one of our council members said, I actually don't have to worry about my disease. What I have to worry about is how I'm going to afford my copays. Right. That should never be the case in this country.
No, in any country, right?
Exactly.
So what role does the PAN Foundation play in educating patients, healthcare professionals, and others about these, anticipated and I think we're kind of concerned a little bit, right? Upcoming Medicare Part D reforms that go into effect on January 1st, 2025.
Yeah, it's a great question. And just to give you some context, for really more than a decade, PAN has been advocating for the reforms that are coming January 1, 2025. And those are the Medicare Part D cap of $2,000 and the Medicare prescription payment plan. Mm-hmm. Because of the work that we do and have done for 2 decades, we've seen firsthand the toll that paying those thousands and thousands of dollars out of pocket for medications can take on anyone, especially people on Medicare. And we always thought that having a limit on what is spent out of pocket was the right thing to do for patients. So we were really happy to see that after many years of advocacy, that Medicare Part D cap of $2,000 was included and enacted into law with the Inflation Reduction Act. And that was, 2+ years ago. A decade ago, PAN actually pioneered conversations around what we have always called smoothing. And I know it's a common term with many, many patient and provider groups. And it's this notion of spreading drug costs over the calendar year. And we believed and still do that spreading those costs could actually make treatment more affordable for many. Well, smoothing has become the Medicare prescription payment plan, enacted into law through the IRA, and is now going into effect January 1. So we are now turning our attention to educating patients and healthcare providers about these 2 reforms. There is a lot to unpack with them, especially the Medicare prescription payment plan. So, we know education is needed. We actually did a national poll of people on Medicare about 2 months ago to understand how aware they were and their knowledge about these 2 reforms, both the cap and the Medicare prescription payment plan. I wasn't really surprised by this, but 9 out of 10 Medicare beneficiaries had never heard or read anything about the Medicare Part D cap. So we've got a lot of work to do. We actually launched a national campaign earlier this month in October to educate patients and providers about the reforms. We've expanded our content on our Medicare Reforms Education Hub on our website, which is panfoundation.org. We've put together some educational booklets in English and Spanish about the reforms. We have some companion videos also in English and Spanish. We're doing a whole lot of webinars in collaboration with many groups about the reforms. And we're also reaching the public through radio. In fact, Just a couple of weeks ago, I participated in a national radio tour where through about 26 interviews with radio stations across the nation, we were able to reach tens of millions of people with information about the reforms. So we take our role in terms of educating about the Medicare reforms very seriously.
Oh, 100%. When people ask me, I kind of liken it to budget billing with like utilities, right? When I had a young family and was trying to, just made it easier for me to be able to anticipate every month, right, the money that was going to go out. And so I could do that as opposed to, in the summer having this huge air conditioning bill or in the winter, this huge heating bill. So I kind of try to explain to people that way, right? It just makes it a little bit more predictable for folks.
That is a great analogy. And it's an important one because I think it can help people understand how spreading costs can in fact make payment more affordable for them and can help them potentially adhere to their treatment, which at the end of the day is the goal, right?
100%, 100%. So what are the key takeaways that NASP members need to know about these reforms?
A lot. Let me start with, of importance is that we want NASP members to simply become familiar with the reforms themselves and to recognize that they really do have an important role to play when it comes to educating patients as well about both the Medicare Part D cap, but especially the Medicare prescription payment plan. With regard to the cap, this is, a $2,000 limit on what people with Medicare Part D will pay for their medications in 2025, and it's automatic. So, anyone with a Part D plan will automatically benefit from that limit. That is great. It's easy. No one needs to do anything. This cap, we know, will be particularly helpful for people who are living with serious illnesses and have been used to spending much more, right? Higher than $2,000. So now they'll pay less. So that is a good thing. With regard to the Medicare prescription payment plan, this reform is complicated. As we were advocating for passage of what we had always called smoothing, we always wanted this to be as simple as possible, but it comes with its own complexity. It is a voluntary payment option that allows someone on Medicare to spread their drug costs and payments over the calendar year. And by law, all Part D plans, whether they're standalone or Medicare Advantage, must offer their enrollees the opportunity to opt in to this payment plan. And to do so, the patient has to get in touch with their Part D plan directly, either calling them or visiting their website. What they pay month to month is going to depend on what prescriptions they're taking, and therefore the costs may vary from one month to the next. So it is definitely not as simple as, taking that $2,000 cap and just dividing it by 12. Sometimes It may work out that way, but most of the times it will not. We know that, CMS has developed a formula that all Part D plans will be using to calculate the monthly costs. The big difference for patients is that if they opt into the payment plan, they're not going to be paying like they always have for their medications at the pharmacy counter. They're going to receive a monthly bill from their Part D plan, and they're going to have to pay their Part D plan. So here is what I think your members really need to recognize. The Medicare prescription payment plan is a really good reform. It's good for patients, but it is not going to be beneficial for everyone. Mm-hmm. It's going to be especially helpful if someone has a hard time paying, all of their drug costs all at once, or they, simply want to spread them out. For the individual who perhaps has already spent $2,000 in the first 9 months of the year, it may be something they want to think about, or maybe they have a one-time prescription fill of $600 or more. It might be something they want to think about. If someone is not eligible for the federal extra help program, it might be something to think about. And this is a program that we wish more people knew about. It is a federal program. It's also called the Low Income Subsidy Program for people who have incomes up to 150% of the federal poverty level and also limited resources. If they apply, and it's through the Social Security Administration, and they can enroll, virtually all of their out-of-pocket costs will be covered. So CMS and Medicare, for sure, in all of their materials, is emphasizing, think about extra help first before you opt into the Medicare prescription payment plan. Similarly, if one can get a grant from a foundation like PAN to cover your costs, you might not need the Medicare prescription payment plan. So it's not for everybody. What we know is that if the patient determines it is right for them, the best time to opt into the program is right now. We're in the middle of open enrollment season, which started October 15th. It ends December 7th. This is the best time to opt in so that by the time January 1st comes around, it's already set in stone and you're ready to go. Reality is you can opt in to the payment plan at any point during the year, but clearly if you opt in really late in the year, it's not going to be as beneficial, right? Because you don't have as many months to spread those costs over as you would have if you opted in early in the year.
Right. Well, but it does seem like for some of those like seniors, right, who may get, maybe a troubling or difficult diagnosis further in the year, at least it may help a little bit, right?
Exactly.
Yeah.
No, exactly. So, instead of paying everything up front, yes, you can spread it over, even if it's 2 or 3 months. Ultimately, it's up to the patient to decide what is best. The good news is through Medicare's Plan Finder, they have created a tool. So it's really important for patients to be evaluating their plans every year. But I think this year is really important. If there was ever a year to evaluate your plan, it's this year. People need to really look at the plans and make sure their medications are covered in the formularies, make sure their provider might be in network. We know that this year there's at least 2 million people on Medicare for which their plans are going away or may not be serving their counties. So it is really a perfect time to evaluate plans. But going back to the Medicare prescription payment plan, they have worked in a tool whereby if you put in all your prescription medications, you can actually see what your monthly costs might be, which is really helpful. Now, unfortunately, you can't then, if you decide the payment plan is right for you, you can't then opt in through Plan Finder or Medicare.gov. You have to, again, go back to your Part D plan, either call them or go onto their website to go through the opt-in process.
And you mentioned it's Medicare open enrollment right now, right, for next plan year 2025. Are the Part D sponsors, are they educating, right, their beneficiaries as well as to this new program and how it works? Are they providing any type of support?
They are required by law to provide information, especially on their websites. And so that's why it is a perfect place to opt in. Mm-hmm. All the plans are spending time evaluating their enrollees and who may be most likely to benefit. And they're identifying those people because of the out-of-pocket costs that they may have already incurred. Either they spent, $2,000 or more already in the calendar year, or they've experienced a one-time prescription fill. So they're reaching out to enrollees that way and also alerting the pharmacies to those individuals who are most likely to benefit, because then the pharmacies also have to do a little bit of outreach with those patients as well.
Okay, sounds good. So what, if any, impact are these reforms going to have on charitable assistance foundations like PAN?
That is a great question, and I'm glad you asked because we have a lot of thoughts about this. Like we do every year, PAN will be evaluating and potentially changing grant assistance amounts for all of its disease funds. And as I said earlier, we have about 80 of them. And the assistance amounts change as of January 1st. So this is not anything new for us. We do this every single year. In some cases, we know that our assistance amounts may lower due to the Part D cap. In other situations, they could be adjusted upward just because we've evaluated claims history and realize that there's a mix of both Part D and Part B drugs. So, in any event, we're evaluating all of our assistance amounts to see how they need to change. The Part D cap in and of itself is not going to impact the foundation and how we provide grants to patients. What we are hoping, however, is that our donors recognize that patient need is not going away just because we have a Part D cap of $2,000. And in fact, given the same level of funding from, this year, we could, in many instances, help maybe 3 to 5 times more patients, because maybe our assistance level for a particular fund was pretty high this year, but maybe given the Part D cap, it goes down to $2,000 in 2025. And if we had the same level of funding, we could help more patients. And we know the patients are out there. We have wait lists. All the foundations have wait lists, and we know that we're just tapping the surface of meeting patient need. Over the last couple of years, we've commissioned research with Avalere that actually illustrates that even with a Part D cap of $2,000, millions of Americans will still have affordability challenges. So yes, $2,000 may be an improvement for so many people, but it's a lot of money still for so many. And we saw in our research, particularly if you're someone with low income, we saw, in the Black and Hispanic communities, there will continue to be affordability challenges. What we also project, and we'll have to see how this plays out, is that with the Part D cap, people may be more apt to begin treatment for conditions that previously may have just been unaffordable for them. They couldn't afford the out-of-pocket costs. So that may be sort of a positive consequence of the Part D cap. But, many of us in the patient advocacy community and provider community are concerned about what we call the unintended consequences of these reforms. So there's a lot of financial liability now on the Part D plans. So what might happen? Are we going to see plans not including certain medications on their formularies? I think we may be starting to see that. Are we going to see increased cost sharing, for patients? Are we going to see more prior authorizations and more step therapy? All of these unintended consequences, are things that we're going to monitor, and we want to keep track of because it's, the Part D cap is great for patients, but if they're going to have these additional barriers, we need to monitor that and make sure that we're providing this kind of information back to CMS, who put these regulations, got them implemented and put all the guidelines together.
Sure. Yeah. I guess only time will tell, right? When we see.
Yeah. And I think time will tell. I think for the Medicare prescription payment plan, I always like to say, this is not going to go so smoothly. There's, it's going to help many people in 2025, but there's going to be bumps along the road. We know that, and we just kind of have to work through it and see how we can improve implementation as we go along, and also monitor outreach and education. We want to make sure that truly the people who can benefit the most are aware of the Medicare prescription payment plan, because they are the ones that have to take action to actually opt into it and benefit from it.
Right. So in addition to the Medicare reforms, what other advocacy and educational topics is the PAN Foundation currently working on?
Well, the Medicare reforms are keeping us really busy, but there's a lot of things, both from an advocacy and education perspective, we're working on. I'll start with advocacy. Some of the other issues that we've been advocating for and we're pretty busy with relate to prior authorization. So there's, the Improving Seniors Timely Access to Care Act, which we really, hope can get passed by the end of this year. We'll see what happens with that. We have step therapy, which is an issue that's of importance to us. Have the Safe Step Act. One area that we have long advocated for in terms of legislation is making sure that Medicare covers dental, vision, and hearing services. Mm-hmm. It's such an important area for people on Medicare. Actually, it's an important area for everyone, no matter what insurance you have. So making sure that these kinds of services are covered, whether you have Medicare, Medicaid, or are commercially insured. We've long advocated for permanent telehealth expansion, and we're spending a lot of time advocating for banning alternative funding programs, which we know are growing in popularity with employer-sponsored health plans and kind of wreaking havoc with the patient community in terms of preventing access to the medications they need. We're also, we launched earlier this year our Center for Patient Research, and it's sort of the umbrella under which we commission research like we did with Avalier. And we do a lot of national polling because we want to hear from patients across the country about the challenges that they face accessing the care they need. So those are just a few areas kind of in the advocacy pillar that we're focused on. When it comes to education, a few areas, we are really proud of one program that we just recently launched. We launched it at the same time that we rebranded with our new mission. And it's in the area of clinical trials, with a focus on diversity in clinical trials. Our initiative is called Opening Doors to Clinical Trials Initiative, and it is really focused on educating the public about improving their health literacy around clinical trials and letting them know that participating in clinical trials is a good thing for them to consider. We did a national poll around clinical trials recently, more than 4,000 adults, and overwhelmingly we found that kind of the number one reason why people were not thinking about clinical trials was simply because they hadn't been invited to have this conversation. Patients are not talking with their healthcare providers about it. Healthcare providers are not talking to patients about clinical trials. And so we're on a mission to increase the conversation around clinical trials. So we've launched a digital platform, which is clinicaltrials.panfoundation.org, to improve health literacy. We have a tool called Trial Finder, which is a more consumer-friendly version of clinicaltrials.gov to help people find a trial. Mm-hmm. And one part of this program that I really love is our companion access navigators who are there in our call center, live people, to answer questions people might have around clinical trials and to address some of the barriers that they often face as it relates to participation. So that's one really big area that we are focused on and look forward to expanding in 2025. We will, of course, continue our work with Medicare reforms in terms of outreach and education and doing our own monitoring around these unintended consequences that I just spoke about. In a few weeks, we're launching a national campaign to educate patients and healthcare providers about alternative funding programs. Oftentimes, we find patients are simply not aware kind of what they're in the middle of, mm-hmm. And what they might be able to do to improve their access to care. And some of what patients can do is simply sharing their stories, which are so important to help educate, others around AFPs. And then finally, I'll just close with an area that we expect to do a lot of work in 2025. I have been with PAN for 20 years. I continue to be maybe disappointed that, still so many people in this country are not aware that there are financial resources out there to help them. Now, not just talking about foundations like PAN, but talking about, all of the manufacturer patient assistance programs, talking about the federal extra help program, state pharmaceutical assistance programs. So we're on a mission to help educate patients and healthcare providers about the range of financial resources that are out there. And then kind of, in conjunction with that, and one thing that we found through some polling that we did, it's really hard to understand what's in one's healthcare plan and all the challenges that are associated with accessing medications through one's healthcare plan. So providing some additional education, particularly for patients, about how to navigate the complexities of your healthcare plan and just Medicare specifically in general, because we know Medicare is complex. It is not easy. You have Part A, Part B, Part C, Part D, and Part D in and of itself is complex. So we want to do a better job of getting information out there so that patients can, at the end of the day, find assistance and access medications they need to stay healthy.
Sure. Do you find that, some patients it might be like a pride thing, or they're a little embarrassed to admit that they need help?
I think that's true for many patients. And we have to kind of dispel that and just say, medications are expensive.
Right.
You're not the only one. And what's most important to you is your health. And if we can help you get that assistance and get a grant, that's the best thing that can happen. So really, put the pride aside. It's not anything that you did that put you in a situation where you can't afford these medications. It's our healthcare system, high out-of-pocket costs, and that's why these Medicare reforms are really so important and a step in the right direction. We have a lot of work to do, right? The $2,000 cap is good for people on Medicare, but what happens to everybody else? You have commercial insurance, you're faced with similar issues. So I know there's interest in Congress in terms of expanding this cap. It may take time to do that, but again, we have a lot of work to do to improve access to care. If you're a patient that is struggling affording the care, again, just know that there are resources out there and we can help.
Right. And it's not just the medications, right? When you think about it, there's other treatment costs, there's time.
Exactly. It's the total
it's gas. It's all of that, right?
It's all of that. And I'm glad you brought that up, because one area that we have been hearing a lot about, which is an area that we hope to expand in 2025. Yeah, prescription medications are high, but it is a component of one's total cost of care. So we've heard a lot about premiums increasing. That's a big chunk of expense for patients. And so we hope at PAN to be opening up more assistance programs to just address those premiums. We do have a transportation program for people who are enrolled in our funds, because we know that that's a barrier to getting care. And so one can use our transportation grant not only to get to a healthcare provider or to get to a pharmacy, but if you need to get to a therapy session or you need to get to the grocery store to put food on your table, you can use our transportation grant to do that. But yes, Sheila, to your point, there's all kinds of costs that go into a patient's total cost of care, the co-pays with doctor's visits and all the diagnostic treatment that needs to happen. So yes, there's a lot of access challenges relating to cost for sure.
Absolutely. Well, Amy, I could chat with you all day long.
Likewise.
It's been such a pleasure, and I can't thank you enough for sharing this valuable information. So much to come, right? January is just around the corner, and there's a lot to educate people about to make sure that they're all prepared as well, right? To take full advantage of what these reforms can offer.
Exactly. I really appreciate the opportunity to talk with you, and your organization is terrific. We've had, a very strong collaboration with NASP, and we will continue that. So again, thank you for this opportunity.
No, absolutely. And one thing I did want to ask you, all of this information, I'm assuming, is available on your website, right? So where do people go if they want to learn more?
Yeah. So about PAN Foundation in general is panfoundation.org. For our Medicare Reforms Education Hub, that is panfoundation.org/reforms.
Awesome. Well, again, Amy, thank you. And as a reminder, NASP corporate members are invited to be my guest on one complimentary podcast per year. For more information about this or other NASP membership benefits and events, please feel free to reach out to membership@naspnet.org or visit our website at www.naspnet.org, where we do have some links to some of the great programs and resources that Amy and the PAN Foundation offer as well. Until next time, have a great day.